In the normal, healthy heart, there are two heart sounds. The first heart sound is produced by closure of the mitral and tricuspid valves, indicating the onset of ventricular systole, as they are pushed shut. The sound of the two valves closing normally merge into one. If the sound is split, this indicates likely pathology. The second heart sound is produced by closure of the aortic and pulmonary valves, indicating the onset of ventricular diastole. Again, closure of these valves is just one heart sound, but may be split, either as a normal variant, for example, when someone takes a deep breath in or lies down, or as a result of pathology.